Today we're talking about what is the importance of the sealant during and after a root canal. The sealant is used when we're finishing a root canal. The sealant is used, as we have in our model here, that is the best model. It's a bioceramic material, and this material is worked to seal the canal between the end of the root all the way with the gutta-percha. We have the gutta-percha here. Amanda usually give it to me when I'm working with a patient, or Arlene, and the canal is disinfected, it's dry, and now we have to grab this that Amanda didn't put the spatula on top, and this is a sealer, okay? This sealer has to be in certain amount, then it's gonna be placed right here with the gutta-percha, and in this case, I'm gonna place it so you guys can see more clear, and it's entering, and it stays right there, and after that, we're gonna cut, recondense, and be sure everything is sealed. Now, why is important? Because if we don't use the sealant, it may not be an addition of the gutta-percha with the material that we're gonna use. And if that doesn't happen, then the root canal will fade, not only because of this, but for many other reasons. However, this canal has to be disinfected, it has to be clean, it has to be dry. If you as a patient have pain or there is bleeding coming out, they cannot dry the canal, it's an abscess. An abscess where the pus is coming out and they drain it, and after they drain it, you still have something like this, like a pimple. I don't know if the camera can catch it well, but this is like a pimple, right? So when you have these type of infections, it has to be clean. When it's clean, it has to be disinfected and dry again. How are we gonna dry? You're gonna hear the endodontist talking about, give me the paper points, and these paper points are gonna be used to dry the canal inside, just like the gutta-percha. It's fascinating, and that's what I love, my specialty. So we get the paper point, we're gonna place it here, we dry the canal. I used to smell the canal. If it was a bad smell, then you cannot close the canal, or we used to do cultures. Now, after that, everything is right, the sealant is perfect, we're gonna condense. And if this is not done correctly, or your crown is not done correctly, this is something that is gonna fail. And let me tell you how. After the root canal, there is gonna be space. In that space, you have to go to see the dentist. The endodontist has to place, I use a very strong cement to place a cotton and then a temporary cement. But if that temporary cement is not strong and the patient doesn't go to the dentist immediately or within 30 days, you know what's gonna happen? Bacteria is gonna get into the canal. And if the bacteria gets in, the root canal is contaminated. So I am really neurotic about it. And be sure your dentist knows when are you gonna see, your endodontist knows when are you gonna see your dentist. So he's gonna completely seal and prepare you for, your dentist will place either a buildup, it's called this reconstruction material, or if you need a post, they can place a post, or so when they're gonna prepare you for a crown, then you're gonna get to this point that they're gonna prepare a tooth like this, but in the molar, if you see right here. So when they go, your dentist will make a beautiful provisional. Here we have Dr. Vijay, who does the provisionals, are really nice. And after that, the final cementation, that is gonna be the final crown. But listen to this, if you see something is getting stuck in between, the crown is not sealed correctly, or the crown, you cannot close the mouth, or is the sealant is not coming out correctly. You know, when they seal your crown, if there's any cement and you cannot clean correctly, go back to your dentist and tell them something is in between my teeth, please do something. Or my tooth don't touch, they have to adjust the bite. So be sure that nothing is high on the bite. And why did I say that? Because example of this patient that I have here, she was here in 2021, they broke a post. This is a perfect example about the sealant. They broke the post is separated here, they were gonna extract the tooth. They recommend the patient to come to my office and we redo the root canal. We did a beautiful treatment on 2021. In 2023, guess what happened? She comes back with a huge infection, just exactly like I told you in this model. And then she said, doctor, what I'm gonna do? She comes with this infection and it's coming out so much pus out of the mouth. She was upset, and I said, listen, you only have 2 years. Let's watch why this is failing. We clean the canal correctly, we dry the canal correctly, we'll seal with the cement, the gutta-percha, we cover, but guess what happened? The dentist somehow missed. When they cemented the crown, they left the space without probably, of course they don't want to do it, it wasn't not conscious about it, but sometimes the patient is grinding their teeth so much that when they grind the teeth and they're not protected, or they're like clenching like this and it's not protected, then guess what's gonna happen? This cement can break down or we can break our crowns. Now, what happened to her? She came in 2023 and I have to talk to the dentist to remove this crown, and I will have to recheck because most likely we have to redo the root canal, which means I have to remove the gutta-percha that I said with the sealant. And this is why I tell you as a conclusion, before they're gonna finish your root canal, be sure you don't have pain, there is no bleeding, there's no exudate, and most importantly, that you are happy with everything that your dentist is explaining to you about a root canal treatment. The sealant is important because everything else has to be sealed. This has to be sealed, and it's gonna help you to be together with the gutta-percha right here. And after that, they have to do the build-up and then your crown. I hope you like this episode, and if you have any questions, let me know. Thank you.